daughter Kathleen made this for me when she was 7. She's 16 now. And as I look at this before my shift, it gives me some resolve and inspiration of why we're doing this. She could see the writing on the wall even back then. So as I take off my wedding rings before my shift, they pose an increased infection risk. I remember what I'm called to do.
My name is Dan Corson-Knowles and I'm an emergency physician. I'm on the front lines of COVID-19 and I'm an IU alum.
My name is Gavin Ingalls. I'm an emergency medicine physician at Ascension St. Vincent. I graduated from Indiana University School of Medicine in 1996.
Hi everyone, I'm Ashley Sartorius. I'm one of the emergency medicine faculty at Eskenazi in Indianapolis.
Hi, my name is Jeanette Conrad. I am a clinical instructor at IU School of Nursing in Indianapolis. I am also a critical care nurse at IU Health Hospital in Avon.
Hello there, my name is Kennedy Hanacho. I am a 2017 Indiana University School of Medicine grad.
Hey everyone, this is Roberto Suazo, one of the first year pulmonary and critical care fellows here at Indiana University. I just wanted to give my 2 cents regarding this experience in COVID-19 times.
I've been working all night. It's been interesting here because our volumes are lower than normal, but the people that we're seeing are really sick. And I've been doing emergency medicine for a very long time. I've never seen anything quite like this.
One of the misconceptions is that COVID-19 is like a flu. And for most people who develop symptoms, they'll be mild, like a fever, chills, headache, body ache, cough. But unfortunately, COVID can make a person very, very sick. And that's what we've seen in the emergency department and in the ICUs.
The hardest part of all of this is a lot of people are scared and they know what's going on. And so ushering them through this has been pretty tough. Less than 20% of people make it off event. I've picked up their phone, I FaceTimed with their family and have been a part of that final conversation. I've been doing this for over 20 years. I've talked to a lot of families about death and dying, but to be a part of that intimate moment where you're holding the phone for someone as they say goodbye to a loved one for maybe the last time, it's tough.
So I've been on the front lines now for the better part of about 2 months or so. Shifts are long, they're physically and emotionally exhausting. Caring for critically ill patients is always challenging, but more so when it comes in volumes and waves the way that we've been having recently.
I haven't seen my family as much as I want to. I sleep in the basement. I go home and I shower as soon as I'm done with my shift. On my days off, I stay at another place so that I'm not around my family because I don't want to expose them to this. It's rough. It's difficult for me personally, but it's more difficult for the people who are going through this. And even though I'm at risk, I don't want them going through this alone.
I've had a lot of colleagues who have contracted the virus. One being a hemodialysis tech, well known in the hospital. He unfortunately contracted and immediately perished.
From my own personal experience with COVID-19, I did develop it a few weeks ago and I'm now recovered. Fortunately, my symptoms were mild.
I wanted to share about a moment that I found particularly impactful, or one that really hit home for me. And it was a moment in which I found out that I was being deployed to Eskenazi to work with the first couple of COVID patients that were first diagnosed. And the reason that it hit home for me was because these patients were extraordinarily young. They were in their 30s, and it really hit home because it could have been any one of us.
Our unit is traditionally an 8-bed ICU unit that has quadrupled in size in order to meet the needs of the COVID patients that have been coming to our facility. It was astonishing. I was humbled. There was nurses from different units, different backgrounds, different levels of experience. We even had nurses come from different hospitals in order to help us care for these patients. It was definitely a team approach.
Find the good, see the good, help people out when you can. You know, we all feel more connected when we help one another, so pay it forward if you can.
I think Indiana trained me well. I'm proud of what I'm doing. There's a lot of sacrifice to it, but I think we do a lot of good, and I hope I do a lot of good. Good luck to everyone out there who's interested in medicine.
One of the most important lessons that I've learned in my time at IU is that we're strongest together, and we'll get through this together. I know that the changes we're all making in our lives are very disruptive. They've certainly been challenging for me personally, and they've been challenging for many of my coworkers and colleagues. We know that most people who are infected with COVID-19 will be fine, but some won't be. And as emergency physicians, we'll be there for them when they need us. I want to say thank you to each of you who are making hard choices to keep those around you safe from this virus. In the spirit of old IU, remember, never daunted, we will not falter. We'll get through this together. Thank you.